Welcome to the Restorative Longevity Podcast, where we share how to increase your quality of life while also increasing your longevity. Yes, you heard that right. We refuse to believe that as we get older, our quality of life naturally declines. And that's exactly what you're going to hear on this podcast. How to defy the odds with simple, effective strategies that anyone can implement into their daily routine. From holistic health practices to time-tested wisdom, we're here to help you thrive, not just survive. Now let's welcome our host, Jimmy Yen, also known as the AccuSensei. Jimmy is a licensed acupuncturist, herbalist, nutritionist, and restorative longevity expert dedicated to guiding you on your journey to vibrant health and lasting wellness.
And so got a cool interview today that I'm bringing you. And so for those of y'all who have come to our clinic in Austin, Texas, Achieve Integrative Health, you probably experienced something during the initial exam, and it's something called thermography. It's where, we take a picture of you and we see you light up in different colors. And so today I have the honor and pleasure to have the CEO of the company that we acquired this technology from, and she's going to be able to go into more details about why you should get a thermography scan and what can it do and so forth. So excited to dive in deep into that. But before we do that, let me welcome Kristin Burton. Kristen, it's great to have you on our podcast.
Great to be here, Jimmy. Thanks for having me.
Awesome. And so, Kristen, can you give a little background so the audience knows who you are, your background, your training, blah, blah, blah?
Sure. It goes all the way back to the 1980s when I was in college and majored in biology. Fast forward through a lot of natural health training, and I discovered medical thermography in the early 2000s and became a patient of Dr. Carol Chandler, who is now considered the mother of modern day thermography worldwide. She's the celebrity in the thermography community. I actually started working for her, and she trained me to be a thermographer, and to learn at her feet and to spend time with her was just an honor, and I still do to this day. I worked for her for many, many years, and then when she decided to retire, I bought the company, and been doing imaging for the past over 14 years. And in between that, I started a mobile business while I was working for Dr. Carol and established 26 locations around the state of Florida. And we really learned a lot about, working with patients, working with doctors such as yourself, as we're imaging for them and with them. And now, as I own the company and I'm learning kind of the business side of helping other thermographers create success in their own clinics, that is something that comes pretty naturally to me because I've been, I did it myself.
Yeah.
So I'm just so excited to be here. What an amazing journey. And when I look back, I'm like, wow, it was the perfect journey and I'm in the perfect place.
Awesome. Great. So thank you. So let's just dive deep into it. Let's get into the meat. So let's just start broad because some people may not even know what thermography is. So what is thermography?
Sure. So it's a way of imaging the human body. We use a non-invasive infrared camera. So there's no rays going into your body like X-ray or MRI. There's nothing bouncing off your body like sonogram. It's non-invasive, and we are actually capturing an image of the inflammatory processes that are possibly brewing in your body. And the reason why doctors like that is because it kind of lifts the veil on inflammation, which a lot of people know is one of the first signs that your body is having a challenge. And oftentimes the client or patient doesn't even feel it. They don't know what's going on, but it's those first little bits of inflammation, if you will, that we can look at. Our interpreting physicians who read all the reports and send them and, create the reports, I should say. They send back a report and say, hey, you've got a little bit of inflammation here, and you and your doctor work on that together. We're uniquely positioned to work with acupuncture physicians, chiropractors, integrative and functional doctors like yourself, because they focus more on kind of proactive work, prevention, things like that, where they want to look at these early signs and see if they can do something about them, as opposed to like waiting for a possible symptom. So we sit you down in front of our camera. It's really easy. We take images of you like the ones you see behind me. And when you take a look at the red in those images, that's where the inflammation is showing up. And that's where the doctors can, create this report that tells your doctor, here's some areas to work on.
Great. So let me just summarize. It's inflammation. So it detects inflammation in the body. Does it detect all inflammation or just some inflammation?
We always say, we see what we can see. What does the body want to show to us? So the answer is it detects the inflammation that we can see. So not all inflammation, maybe something deep in the body, maybe something that, just it's not showing up on the surface of the skin, because it's important to know that your body puts patterns on the surface of the skin. And Chinese medicine realized that thousands of years ago, when you can put a needle in 1/4 inch deep or 1/8 of an inch deep and make a difference for the body. Well, the body in turn shows us signs that something's going on as well. And so not always, we can't always see it, but when we do, hey, we want you to know about it so that you can do something about it.
Yeah, that's good. And so you mentioned, definitely with practitioners who want to be proactive, preventative, how does are you saying that thermography can detect inflammation before it shows up on blood labs?
Sometimes. I mean, it's not, yes. The answer would be sometimes, because again, you come to us and we see what we can see. So oftentimes it is a very, very early look. It's just a time where your body is maybe struggling to fix something. And I always say this to patients. I say, hey, your body doesn't really want to bother you. It wants to try to fix something first. Let's just get it fixed. Jimmy never has to know. We'll just get it fixed, right? But then if the problem continues, or if it's getting worse, or if the client or patient is not adjusting their lifestyle or their supplementation or whatever it is, their diet, then now your body's like, we gotta tell them something here. So let's give it some pain. Let's give them some discomfort. Now all of a sudden the person goes to their doctor and the doctor's got something to work with. But with thermography, we can see it when the body's just trying to deal with it and maybe not giving you any symptoms, any pain, any discomfort, any redness, any whatever, any labs. Yeah. That's
great. That's great. That's a great. Yeah, that's a great analogy that our body doesn't want to bother us initially. So, yes, that's beautiful. So next question, it's why would I want to get a medical thermography when I go to the doctor, I'm getting tons of blood tests or stool tests, saliva tests, whatever tests. Why would I still need to get a thermogram?
Because we lift the veil on inflammation. So when you look at other tests out there, they don't show inflammation. Like MRI doesn't show inflammation. It can show the results of it, the effects of it. Sonogram, bouncing waves off, not detecting inflammation. X-ray, nope. So, hey, we've got this nice little area where we can see inflammation, and oftentimes it's early. But what if it's not early? What if it's because you have a symptom or you have an injury or you have issues? Then we can evaluate that too. But Jimmy, I'll tell you this, the highest and best use of thermography is monitoring. So when people come into your office and you give them a study, like a full body study, say from head to toe, right?
Yep.
So they're feeling fine. They're doing great. You may see a few little spots and dots you want to deal with, right? Little inflammation here and there. You know exactly what to do. You're the doctor. And now let's say you've got that report that says they're doing fine. They don't have a lot of inflammation. Now, does that mean there's not something going on? There could be. But in terms thermographically speaking, we don't see anything. So then 6 months down the road, they have an injury, they have a weird pain, they have, something going on. Now, the comparative study, you image them again. And the comparative study can give you some really good information. Take, for instance, an ankle I just looked at the other day. They felt a little bit of pain in the ankle. You look back to when they were fine, when they had no pain, and compare. It's what's going on. Oh my gosh, look at it. It's not the ankle at all. It's the hip. That hip is jacked up for some reason, and they're weight transferring onto the other foot, causing the inflammation. So we put together little puzzles for people too.
Okay, cool. Yeah, that makes perfect sense. So what someone wants to get, someone wants to get a thermogram. What would it be like for them to get a thermogram?
So we're going to send them a questionnaire that they're going to fill out and give us their health history. And a lot of times people never get a chance to give a full health history. Doctors, they take in a quick health history, quick, tell me what's up, boom. But we take in a full health history, which is great. You get to talk. You get to kind of unload. You get to ask some questions. Then after that, you put a gown on and you sit in front of our camera and you cool off. Now our camera's not live yet, but you're just cooling off. We're talking about your health history, asking some questions. Then when it's time to image, this is a private imaging for most of our thermographers. The MedHot thermographers, we teach privacy imaging. So you're behind some kind of screen or something, and the technician is not looking at you. They're looking at what you see behind me, the thermographic images, and they're capturing those images while you're sitting there, maybe turning. As you can see, take a look at the head there over my shoulder. They're turning and showing us the right side of their head. Then we turn them to the other side. It's really simple. A lot of people are worried because they've had other imagings where they have to lay on a stainless steel table or get slid into a tube or, all of those things. All you're doing is sitting on a stool and looking at a camera and then listening to the guidance of the thermographer saying, turn to the right, turn to the left. Super easy.
Yeah. And just to remind everybody, there is no radiation coming out of these. It's just like getting your iPhone taking a picture, but it's just a different camera.
Exactly.
Awesome. So, I think, people, especially in the females, I would say there is more information about breast thermography. So, and there's, questions, like sometimes we'll get questions from our patients. Should they if they're doing breast thermography, do they have to do the mammograms, But why don't we start talking? Can you give a little more insight about how does it benefit breast health with breast thermography?
Right. Yes. And good for you, Jimmy, that's what you're saying. It's about breast health, not breast cancer detection. So we are in a completely different sphere than mammography. We're trying to look at the breast and looking for areas of inflammation just like we are anywhere else in the body. And in the breast, that could be dilated ducts, toxins in the lymph system. It could be generalized inflammation. We see all kinds of things, and our doctors report on those. And then we teach breast health too. Our thermographers all know how to, talk to their clients about dry brushing and the kind of supplements that support breast health. And let's talk about aluminum deodorants, and let's talk about underwire bras. There are things that you can do. A lot of people think I go get my mammogram and then I cross my fingers for another year or two. But there's so many things you can actually do on the breast health side, and that's what we try to teach.
Yeah, awesome. And so typically, and this is what we recommend to our patients in our clinic, and you can just correct me if I'm wrong. We recommend. Number one, as acupuncturists in the state of Texas, we cannot say anything about diagnostics or anything, and so we always tell our patients, if your physician wants you to do the mammogram, continue to do those. Follow their advice.
Yep.
The thermography, the breast thermography, is more of it tracks, like I said, the health of your breast, and the physiological changes that could be happening, that could show signs of things, inflammation accumulating, and that could give information to your physician, whether to do an ultrasound of your breast or MRI of it, or another mammogram. But we don't tell people people breast thermography replaces mammograms.
Never. That's one of our golden rules, in MedHot at least. We make sure that we tell people this is a examination of the health of your breasts. This has nothing to do with mammogram. So go get your mammogram, get your ultrasound, do all those things too, if that's what you need to do.
Great. And is this, some people may be wondering, hey, is this FDA approved or cleared?
Mm-hmm. It's cleared. So you can't FDA approve it. What you can do is clear it. So we are very in touch with the FDA, especially at MedHot. We make sure that we follow all their guidelines first and foremost, and we've dealt with them personally on a personal and business level to make sure that the records we keep, the things we say about thermography, the claims that we make, things like that are all within FDA guidelines. And of course, we have thermographers all over the world. We have dozens and dozens of them in the United States. And so we make sure that they know what they can say and what they cannot say about it. And hey, we're fine with what we can say.
Yeah.
We're talking, just like you, we're talking about health here. So we're fine to be able to talk about supporting the health of the breast. That's what we do.
Awesome. Great.
Yeah.
And so, some people, let's say people, they're online and they may see some construction people have these thermography cameras as well, right?
Yeah.
So what's the difference? What is the difference between what construction people use and versus this type of medical thermography?
Sure. So construction, the military, our cameras that we sell, our systems are FLIR. So that's the one that has all the military contracts, manufacturing contracts. They're the biggest in the world. And there's a difference. So a lot of those types of people are like using a handheld instrument, much less expensive than the camera systems we use, much less complicated than the medical integration that we do. And it's really cool. So they'll look at a roof and tell you if the heat is escaping in the wintertime. They'll look at, this is a cool one, Jimmy, Emitted Energy, who is a partner of ours in FLIR. They have thermography cameras watching food on assembly lines. So if food has spoiled, or if food, if there's something going on, a fungus growing in it or whatever, you don't have to open the bottle, test it, put it in the petri dish or whatever for every single bottle. You just watch the bottles with an infrared camera going by. Yeah. And there's the bottle that's a different color, a different palette. So if you look at the palette, it's very neat, right? So maybe all of the normal bottles are green, and then the one with the fungus growing in it, their bacteria, is red. Boom! They can pluck that one right off the line. Yeah. And holy cow, right? To me, that is a really cool use outside of medical thermography to be able to detect those kinds of things, and so much more. If I saw a demonstration of a factory, in a big factory where there's machines everywhere, the place is humming. You gotta wear headphones just to be able to walk in because of the machines, right? Yeah. Now, what happens if one of those machines is overheating? I mean, do you go up and touch every single one of them, or what do you do? So there's thermography cameras positioned that are watching and knowing the normal temperature of those machines. And when it goes over, an alarm sounds. Yeah. Coolest thing ever, right?
Yeah. So actually, if you think about it, thermography is used everywhere. We may not be, alert to it, but it's, I'm thinking back now at COVID. When COVID, all of the airports, they had thermography cameras. They still do. They still use it. I was just in Asia earlier this year, and they still have the thermography cameras. And that's how they check your temperature as you walk by without you even knowing.
Yeah, it's crazy. We sold a lot of those cameras back during COVID. It's a little bit unreliable because you get so many false positives. So, they've refined that over the past 4 years, but it was really interesting back when COVID first happened, and all of the conversations we were having with people were completely different than your average camera buyer. How do I put this in my hospital? How do they put this in my, where all my factory workers come in the door, and when they're punching in, they just quick look at a camera. Really fascinating conversations we had.
Yeah. Cool.
Yeah.
So if someone goes online and they Google medical thermography, they're going to pull up, Google's going to pull up, a couple of different companies. How does MedHot's technology differ from other medical thermography companies?
Well, thanks for asking. First of all, we're a partner with FLIR, and FLIR is the thermal imaging company. They're the ones that are on the
gold standard.
They're the gold standard. Thank you. I like that one.
Yeah.
So yes, we're the FLIR partner. So if you were to call FLIR right now and say, I want a medical thermography, we'd get the call. They would forward to us. And we have a partner in between there, that's Emitted Energy. So that's one thing. FLIR, the name, the quality, and also the service. They guarantee, they fix them, they repair them, and when one is discontinued, you can still get service on it. That's huge that people don't even think about. The other thing is our software. So we have a software with a patent on it that is really special, and it's very intuitive. So I talked about Dr. Carol Chandler. She's the mother of modern day thermography. She invented this software, and the software makes it so easy for us to take a look at your patient's images and capture the correct image, create the image for future comparison, and send it to an interpreting physician who can use an element of that software to give you a beautiful report. People don't think to ask about software, but it really does. It's a game changer in the world of thermography. Everybody wants our software, and nobody can have it because we have the patent. The other reason why someone would want to choose MedHot is because of not only that FLIR camera, but because of the resolution. So you've probably seen images where it's really pixelated, and you see like these little, it almost looks like little boxes, pixels, right?
Yeah.
Those are thermographers that are dealing with about 19,000 pixels, and they capture that image all in little boxes, and you can kind of see blobs of color, and it can be helpful. But then the cameras that are about 76,000 pixels, those are good, less boxes, but our cameras are 307,000 pixels. So we can see to the width of a human hair. We also have another one that's a little bit less expensive that still gives us amazing images. So when you look behind me, you're seeing like the lymph nodes, and you can see even to the width of a human hair, you can see things that are going on, patterns instead of blobs. Patterns are so important, as you know, Jimmy, when you're looking at the body, you're looking at a thermogram. So it's just, we have that whole package of service. We have the interpreting physicians that are MDs. Ask, if you're going to get a thermogram, ask, are you using licensed medical doctors as your thermologists? You'll find out that sometimes you are. We have a couple of thermologists that are acupuncture physicians that are tops. Dr. Carol herself is an acupuncture physician. So we use people that know thermography. MedHot is the best. Thanks for asking.
Yeah.
I get passionate about it.
It's a question that people are going to ask, because people love to Google these days. And actually, on a side note, Google the term Google may be replaced. It may be Search GPT now. But anyways. Right. All right. Because now that's what comes up first. Yeah. So but people are going to wonder, right? They're going to compare what's the difference and so forth. So Kristen, I would say one last question. Where do you think the future of medical thermography is going? I think that is a question that goes hand in hand with, where do you think the future of prevention and proactive health and health discovery
And that's the best phrase, is health discovery. Where is that going? Because that's where thermography lives, in taking a journey with your trusted healthcare practitioners to kind of tweak things along the way, as opposed to, I'm sick, I better go to the doctor and find out what's wrong with me. It's that journey. And I'm sure that's what you do with your patients, Jimmy. These are people that they know and they trust you, and you're taking that walk together in health. And so instead of waiting for a symptom to pop up so that you can hopefully do something about it that isn't too painful or difficult or life-altering, you're finding those little pieces of inflammation and other issues along the way, and you're handling them now, and you're creating healthy people. So you're creating true healthcare instead of feeding a sick care system.
Yeah.
So I think that's where thermography is going, right along with the future of people realizing, gosh, maybe I should try preventing it instead of waiting for it.
Yeah. And that's a great point, because especially I would say after COVID happened, I saw a study on PubMed that said I forgot the exact percentage, but it was the trust here in the US, the percentage of people that trust their physicians and trust hospitals, the current Western medicine, sick care system, the percentage of people that had that trust versus it was actually the percentage of distrust. How many distrusted them? And then after COVID, that just it doubled. It doubled in the amount of people that distrust the current sick care system. And so I think COVID really, made people think about their health, and it made them think about really the current healthcare system that we have here, especially here in the U.S. What is it? It's really a sick care and not really a healthcare. So yeah, that was a great point.
Yeah, absolutely. So, that was a great point too.
So Kristen, where can people, someone listening to this podcast and they're like, "Ooh, I need to get a thermography scan." Where can they find someone who is trained, someone who has the technology, the right technology, the best technology, I would say? Where can they find this information?
So we have a nonprofit organization that supports and educates thermographers throughout their business career, and that's called the IAMT, the Institute for the Advancement of Medical Thermography. So if they go to IAMTonline.org, they can go to the Find a Thermographer tab, and you can just put in your zip code. And you can go out 20 miles, 40 miles, 60 miles and find somebody, because you really do want a med-hot thermographer. You want somebody who is professionally trained, who knows how to position people, who knows how to talk to people, who knows how to educate them, and has the best equipment.
Yeah. Awesome. That's easy enough. We will put that link and other additional links in the description. So look out for that, and you can click on that and go and look. Again, we're not saying that medical thermography is something to replace any type of Western medicine diagnostics. It is used in conjunction, and it's used in a progress tracking, preventative, and if you're focused on prevention, you want to prevent things from happening instead of waiting till you have to have surgery, then adding thermography is going to be a great thing for, find someone who uses it so they can be part of your treatment course or treatment plan. That's one of the big reasons why we have it in our practice. And it's very beneficial, especially as an acupuncturist. It's very beneficial for us because with acupuncture, we can move blood circulation anywhere in the body. So having something that can help us detect early on inflammation, acute inflammation, and we can deal with it immediately, get your body to heal it by itself, it's a very invaluable tool. Kristen, any last words to the audience?
Start your health discovery journey. Commit to it, and find somebody like Jimmy. Find somebody that is willing to walk that journey with you, and not just see you when you're sick, but actually help you tweak your health. We don't treat, we tweak. Sometimes we say that, find that, because you're not only going to make your own life better, but you're also going to be a role model for others to admire and follow. And that's how we spread the word. You take it into your heart and then you give it out to others. And we really want, through thermography, to spread that message of health discovery. So commit to that. Think about it. Talk to, those of you who are already dealing with integrative physicians, talk to them about, just really trying to make a difference. Longevity is great as long as it's a quality thing, right?
Yeah.
I've seen people go all the way through their 90s, but that wasn't a good time for them.
Yeah.
Right? It wasn't a healthy time for them. So commit to your quality of life and your longevity, and thermography will be right there by your side.
Yeah, well said. And I'll just add, and I'll end with this. What Kristen said was, so Western medicine is starting to evolve to, increase longevity. But the question that we want you to ask is, do you just want to live long and live long in misery, or do you want to have a better quality of life and live long? It's something that it's a movement that I'm starting with our practice. It's called Restorative Longevity, and it's basically, as you get older, your quality of life gets better, not worse. And so thermography is definitely something that we use, and so we highly recommend everybody get a thermogram. Well, Kristen, this was great information. Thank you for joining us, and thank you for dispensing all this knowledge to us and wisdom. We will, for the audience, replay this, share this with your friends. If you're getting a thermogram, but your friends aren't, your family aren't, forward them this podcast, and make sure you hit the subscribe button as well. And we will see you at the next episode.